Hello everyone, my name is Dr. Tanja Radenko-Medenica and greetings from Belgrade. Today's patient is Svetlana. Objectively, she has brow and upper eyelid ptosis. She complains about skin laxity and overall tired look. Objectively, she also has ptosis and on the lower third of the face and skin elastosis and wrinkling in submental area. Okay, after the proper marking the patient, and of course we have to check the position of the eyebrow, the position of the middle and the lower face, the quality of the skin and the sagging of the skin, and to check again what we will do with this patient and what threads we will use. So in this patient, for the submental area we'll use Nano Excellence. For the lower face we'll use light leaf thread, and for the upper face we'll use light leaf needle. Okay, and to check the right vectors for the proper situation and for the proper threads. Now we will mark the patient. Marking is very important because it is, let's say, half of the whole job that we should do. When we do light lift needle, we should mark 2 triangles, or in some other cases we can draw 3 triangles to lift the eyebrow and the lateral part of the eye. If the ptosis is much severe, then in this case then we can do 3, even 4 or 5 triangles or loops. For this patient we'll do just 2 because she wants to be natural and to do a small elevation of the eyebrow and the lateral tip of the eyebrow and the lateral canthus. When we look at the lower face, she complains about sagging look and this small fat pad in the prejaw sulcus. We mark the entry point, and the entry point is just in front of the tragus, and then we mark the whole vector of the thread. We will also lift the marionette lines and the prejaw sulcus. In the submental area we see the skin laxity and small fat pad, which our patient doesn't like, so we can lift it and we can improve skin quality with these threads. Every procedure we start with local anesthesia. First we inject the anesthesia into the entry points, and then we take cannula and infiltrate all vectors and the whole face, because in this case we are going to do the whole face. Local anesthesia is very good, not just to eliminate the pain, but to do a small hydrodissection, and it enables easier penetrations through skin layers, but we have to be very careful because if we put a large amount of anesthesia, the threads won't get in the right position because they will fluctuate through the skin. So be very careful with putting the local anesthesia, and the amount should be very small. starting the procedure with light lift needle for the lifting the eyebrow and the lateral part of the eye. Okay, we use needle blunt with 50 centimeter thread connected to the blunt cannulas. We are placing the entry point about 5 centimeters above the brow. If we need more lateral lifting, the entry point will be more lateral of the temporal crest, and if we need more medial lifting, it will be more medial to the temporal crest. We are making 2 triangles, as I said before, or 2 loops, and even in some cases you can do more. And we repeat everything the same on the other side. Of course, you should check the position of the eyebrows and the lateral part of the eye to do the same symmetry and to make your patient, of course, satisfied. Okay, we are starting with the lower face. We are using light lift thread with barbs 25 cm long in order to obtain better elasticity and skin lifting and tightening. We are entering through one entry point near the tragus. We are placing cannulas together under the skin under 2 or 3 millimeters depth. And after, we are taking one cannula, sliding it through the skin towards the exit point. It moves easily if you are in the right plane. We are doing it quite superficially because in this area the fat pad is superficial. We are crossing the jaw compartment and we are exiting on the point that we marked. Of course, we are doing all the same on the other side, and please take care about the face symmetry, because if you lift one side more than the other, it will be visible. But of course, after you finishing the procedure, you can correct it if you have in one side overcorrection and in the other side not. Okay, now we are starting with the submental area because she complains about the fat pad and the sagging and bad skin quality in this area. Of course, first you put local anesthesia and do a small hydrodissection, and then we are starting with placing the nano excellence threads and making a kind of net that will lift the fat pad and improve skin quality in this area. Of course, we choose Nano Excellence with hyaluronic acid because we know that hyaluronic acid loves water, improves the skin quality and stimulates the skin and making new collagen and new hyaluronic acid and better skin look. And in the package of Nano Excellent threads with hyaluronic acid, we have 10 threads and we are putting them 5 plus 5, making a net that holds the fat pad and lifts the skin and improves, of course, the skin quality. After we finishing the whole procedure, we put stereo strips on every entry point. And you can look Svetlana, she's very symmetrical and the skin is lifting and the tissues are lifted. We will see the skin quality after a month of 2, but if you can see, we have small hypercorrection in the eyebrow region, but it's normal and it will be perfect, let's say, for 2 or 3 weeks. And of course, you have to check your patient after 7 days, after 14 days, and to see and to picture the improvement. Okay, and this is Svetlana 10 days after the procedure. We see that the eyebrows are lifted, that the lateral canthus is lifted, the nasolabial fold and marionette lines are smaller, and you don't see the fat pad. And of course, we will get more improvement in 3 or 4 weeks after this procedure, because we expect the effects of the hyaluronic acid and the stimulation of the skin. But our patient is very satisfied, as we are also. See you!